wait. My apologies, folks. Oh. The screen is showing. Good morning, everyone. Thank you so much for joining into our PAHU webinar. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL Insurance Group. My duties include overseeing the individual and group health markets, and we're very excited to be a part of the Pennsylvania Association of Health Underwriters, and today we are assisting the Central Pennsylvania chapter of the Association of Health Underwriters put on a program that obviously is timely and a lot of you have been requesting. So I'm going to hand over the screen here to Gil Davis in a few minutes, but I wanted to just give you a few housekeeping items. The PowerPoint is attached for your reference. It is being recorded. So you will all get a recorded version as well as having the PowerPoint available to you. You can ask questions on this webinar in two ways. You can either raise your hand, the little hand icon to the right of your screen on the control panel, or you can type a question into the question box. And just with a show of electronic hands, if you will, if you can just let me know if you can see my screen and hear me okay, that would be great. All right, I see some hands. Excellent. So let's get this program rolling. We're going to keep it to an hour and be respectful of everyone's time. So without further delay, I'm happy to present Gil Davis, who is the President and CEO of the Pennsylvania Dental Association Insurance Services and Bell Insurance as well. Gil, thanks for putting this on today.
Thank you, Deb, and also I want to say thank you to Deb and URL for utilizing their webinar and their technology, so we appreciate that, Deb. I just want to say a few things as the Central Pennsylvania local president of the organization. I would be remiss if I didn't say, as a president of the association, that now is probably a good a time to become a member. Not that it's never a bad time, but we've gone through almost 6 years of high level of frustration, if you want to put it that way, in our profession, and now we have some optimism taking place with, hopefully, with some changes coming positively to our profession with the new administration. So, and that's due to why we wanted to put this presentation on and do it early. But now's a good time to become a member of organization, and you'll look for some things in the near future of some communications coming out, of some great things that we're going to be doing within the next year through the local and the state chapter. If you'd like to become a member and get involved, bodies are important as we lobby on our behalf. Go on our website and send me a communication, and we'll see that we get in contact with you. Without further ado, I'd like to introduce you to today's speaker. Probably most of you have heard Mr. Vince Phillips speak, and a wealth of knowledge in our industry, and does a fabulous job in his presentations. And we appreciate very much of him taking the time to put this presentation together. As Deb has said, it's very timely and important for us to know what the potential changes will be, or that President-elect Trump would like to try and get through if repeal is not possible, some changes within the first 100 days, and especially as it's one of his top priorities in the 100 days to make change to Obamacare. So without further ado, our state lobbyist, Mr. Vince Phillips, it's all yours.
Good morning, everybody. How are you? Nice rainy day. Good topic for a rainy day. Let's talk about health care reform. Oh, wait a minute. People are dropping off. No, they're not. Hey, I'm just very happy to be with you today. A couple of notes before I get started. Number one, I would like to thank URL again for hosting this, and of course the Central Pennsylvania Association of Health Underwriters. Miscellaneous disclaimer: the views reflected here are not necessarily the views of URL. And unless, of course, URL agrees with everything that I say, in which case, well, maybe they are. The other thing I would like to do is I would like to recognize the leadership of PAHU's President-elect, Damien Mochin, who is part of the webinar this morning, although not in a program role. So Damien, very glad to have you with us. Now, in terms of getting started, what I thought I would do was to give you one day's news, just to say that there's a lot going on, and then kind of add as a punchline, oh yeah, there's something going on with the transition team that we should check on. But realistically, I probably should have updated this, I don't know, maybe a half hour ago or so, to show the status of the recount request by Jill Stein for Pennsylvania. Please let me know if she wins at the recount. That the president-elect has suggested that he also won the popular vote. He appears to be about 2 million shy of that goal. And of course, we now have a new HHS Secretary-designate, Representative Tom Price, who is one of the leading critics of Obamacare, and now he will become a campaign tool for former Speaker of the House Pelosi as she clings to her position with the Democratic caucus. So just kind of get you started. Now, just to give you a quick, I'm going to give you a very quick election recap. This is news that you already know, but I thought you'd like to see a couple of the statistics. And then the focus is going to be on the positions that Trump has taken, the positions that the Republicans have taken. And that's especially important when you consider that Speaker Ryan put together a comprehensive set of Republican congressional proposals, and very likely much of that will be adopted by the Trump administration once they get their thing started. I want to talk a little bit about executive orders and particularly about some of the federal regulatory repeal hoops that have to be jumped through. And of course, the takeaway, which is, if I'm right, I'm absolutely right. If I'm wrong, well, who can read the future anyway, since my subscription to Psychic Hotline ran out last week. Now, election recap. By the way, those numbers are incorrect. Michigan just came in yesterday, and so Trump has an additional, I think, 16 electoral votes. The Clinton plurality here of 1.2 million votes, that was from Politico early last week. Obviously, the numbers have climbed a little bit since then. Although, take a look at New Hampshire and Michigan. Those vote totals are pretty consistent. And then Pennsylvania, no one has really said that 68,000 votes did not deservedly go to Trump, or at least not yet. Now, the Republicans kept the Senate. A couple races are a little close. For example, the incumbent Republican in New Hampshire, 716 votes. And I'm not sure that there's going to be a recount, but that's still a pretty close margin. And then, of course, Louisiana still has a runoff. Their system's a little strange in that if one of the candidates does not get 50% plus one, they will have a runoff of the two top vote getters. There are about 15 people running for that Senate seat in Louisiana. Fortunately, Duke did not survive, depending on your point of view, but mine is that Duke did not survive that. So you have a Republican and a Democrat running for that top office, with the Republican being given the edge. I also put down, as you know, Pat Toomey won. I put down the vote margin. Now, in terms of the U.S. House, the Republicans have a 45 vote margin. Again, Louisiana, so you have two non-settled races where the Republicans are given a decent chance. Now, Democrats did make some headway, but they only picked up 6 seats. They kind of needed 30 to actually do anything. In Pennsylvania, the Republican edge remains as it was before, although you do have some openings. For example, in the 2nd District, Chautauqua was indicted, convicted, and so Dwight Evans, former state representative, is the new Democrat in that district, and Republicans retained the 8th District in southeastern Pennsylvania and the 16th District a little closer to our area. And of course, as you know, the Democrats took the top offices. Interesting dynamic, isn't it? The president goes to the Republicans, the Senate goes to the Republicans, the General Assembly goes to the Republicans, as I'll show you, and the row offices all went Democratic. By the way, Democrat Josh Shapiro is a former state legislator with whom PAHU has worked on areas on which we could agree. Now, in terms of the Pennsylvania Senate, now they have a veto-proof relationship with the governor. And I listed here the open seats that the Republicans took. And the big surprise there wasn't so much Dauphin County, because Perry County voted 75% for the Republican challenger. But the real surprise was Erie, where you have a Democratic district, which is the prototype Democratic district, and blue collar, multi-ethnic, etc. And 53% of the vote went to the Republican challenger that very few people had heard of before. Although you'll hear more of him, he is a builder, so I expect they'll give him a nice committee spot because of the nature of that upset. And then I mentioned that other open seats stayed with their party, and I mentioned some of those, including the 31st District, which is Cumberland County. In the Pennsylvania House, Republicans strengthened their control. They won 3 Democratic seats, but they lost 1 seat. Now, there is a district, the 156th District, where the final outcome is not entirely known yet. But still, though, the Republicans strengthened their control. Some of the closest races, and this is a slide that I put together to show if someone says, my vote doesn't matter, I think this effectively refutes that. You have a district going Democrat by 28 votes. You have another district where the incumbent Republican lost to the Democrat by 841 votes. Representative Quigley retained his seat by 574 votes, and Democrat retained her seat by 240, and the 168th District, which is Delaware County, Chris Quinn won by 168 votes. I want to note to you that Quinn has an insurance producer's license. So we're very glad to have him reelected to the General Assembly. Obviously, when it comes to get acquainted, he's going to be pretty well tops on PAHU's list. Now, I mentioned about one district perhaps not being resolved just yet. Dan Truitt, Republican, is losing by 18 votes. The original vote count had the Democrat winning by 78, but when you count the provisional ballots, when you count some of the absentee ballots, and you have some that are being challenged gently by both sides, so that one's still up in the air. But in any event, it's not going to matter. The Republicans still have a huge plurality for the General Assembly. Okay, now the main attraction, President-elect Donald Trump. Now this slide is very long because I thought the best thing to do would be to take his campaign platform and just present it to you pretty much as it was. I edited it a little bit for space, but take a look at it. Well, first of all, we're going to repeal Obamacare, no surprise there. The drug prices are increased under Obamacare because of the tax on drugs, and he agrees that the entire act is invalid in its entirety. And now, of course, then the political rhetoric begins, but still, we've got to restore some of the traditional relationships, the patient-physician relationship, rather than having the government intrude into that relationship. And so, of course, affordable, high-quality health care. So what are those positions? What are you going to replace it with, looking at the positions that Trump has taken during the campaign? First of all, well, this isn't in order of priority, but most often stated, is that he would like to bring about competition across state lines to allow insurers to compete in other markets. And his idea is that in many areas you only have one carrier or so, and so if you have additional carriers, it's going to have competition. Competition will principally drive down the price or reduce the rate of increase, if nothing else. I would point out to you that the Pennsylvania Association of Health Underwriters has traditionally opposed this position. It's not a new position. Republicans have had this for years in Congress. We oppose the position, and our rationale is that, first of all, marketing across state lines may not work terribly well because of network-related issues. And then, secondly, it weakens state regulatory authority. The Pennsylvania Association of Health Underwriters has traditionally supported state regulation of insurance rather than allowing the federal government to get its nose under the tent, even more than they are right now. So other planks in the Trump platform. Premiums should be deducted from tax returns like businesses can. Strengthening the health savings accounts with a variety of ways. Now, the one that caught my interest, price transparency from all healthcare providers. You know, I've read that he's using the New Hampshire transparency statute as a model. but it's going to be interesting how he translates that into a total price transparency at the federal level. And will that keep the federal government in the control of health game more than some free marketeers would like? Now, in terms of Medicaid, that's kind of simplistically stated, converting Medicaid to block grants. That's a traditional Republican mantra. Actually, maybe it's a little more complicated than that. I think more closely, he's going to give states the option of moving to block grants if they so choose to do. And then the one drug platform, he said, let's remove barriers to entry from imported drugs. You know, it's kind of weird how the world changes. Back when Representative Matsey, Democrat of Pittsburgh, was chartering buses filled with senior citizens to go across the Canadian border to get prescription fills, Obama came down on imported drugs, didn't like them, and now Trump says, well, what's wrong with importing drugs? Before the issue was the quality of the drugs that you get. So be that as it may. Now, here is an interesting wrinkle. Trump says that you can save $11 billion if you don't spend money on illegal immigrants' health care. Now, there's a couple caveats that walk with that. Number one, will hospitals still be required to give care to people who can't pay for it? Secondly, will hospitals be reimbursed for that uncompensated care that they provide? And thirdly, will hospitals have a responsibility in the Trump administration to report immigrants' legal status to the authorities if someone comes in for treatment, which will certainly discourage many people, undocumented aliens, coming in for health care services. So be that as it may. I thought that was the most interesting part of this platform, or at least the one that is going to involve a little bit of discussion on the way. Now, of course, how do you reduce dependency on Medicaid without saying that you're going to roll back the expansion in Medicaid presented by Obamacare? But you reduce those dependencies of those entitlement programs by having an improved economy and more jobs. Now, one thing in his platform will probably get bipartisan support, and that is trying to reform mental health programs, and there's a lot of bipartisan legislation. Now, one point of contention, the Obama administration has wanted to require that states report incarceration in state mental health facilities, report to the federal government so that those released from those facilities can't go out and buy guns. And it may well be that those from the NRA point of view or those HIPAA privacy advocates will resist that federal initiative. And of course, we'll see if that's one of the things that President-elect Trump decides to cancel when he gets in office. Okay, now let's go to the congressional agenda. This is a bit more detailed. Speaker Ryan presented, quote unquote, a better way, June 22nd, 2016. I would say that anyone who maintains that the Republicans do not have a replacement plan might wish to read this, this document, because it does lay out what the Republican credo is. And some of them are a little surprising. Some of them are things that the Republicans have advanced since, well, since forever. But take a look. Okay, no pre-existing conditions. Dependent coverage till age 26. No rescissions. Now that's an arbitrary decision by a carrier to stop someone even if they paid their premium and even if they've previously dealt with any sort of medical issue. Not an issue in Pennsylvania, but certainly down south, rescissions are an issue. Keep the age-to-1 ratio, although change it to a 5-to-1 age ratio. Now, tell me when this begins to sound a bit like maintaining some important features of Obamacare. And of course, Trump, after he got elected, he did backtrack a little bit and say, well, you know, there are a couple parts of Obamacare that may not actually be so bad. And he mentioned the pre-existing condition and the dependent until age 26. So we'll see if there's more erosion of that from the Trump administration. But still, the Republican platform in the Congress, in the House, is pretty definite on this. Now, $25 billion for state-run high-risk pools. Actually, this is something that PAHU has supported for a long time. where you take those who are medically uninsurable, you put them in a high-risk pool. Obviously, this is pre-Obamacare. And it's worked very well in the Midwest. I think at one time where the union was up to maybe 34 states that had some type of high-risk pool. A variant of that is the assigned risk for those of you who have a property casualty base. If someone can't get auto insurance in the private sector normal market, they can go into the assigned risk, which is basically a high-risk pool for auto insurance. It's pretty much depopulated because the auto market is so competitive now. And then innovation grants, premium reduction programs that support wellness. Now that's kind of intriguing, but there's no definition as to what that means. And then two others. One is to make sure that the Hyde Amendment is maintained. That's the one that prohibits federal funding for abortion, and no quote-unquote conscious coercion. And that would relate to many of the lawsuits that have been filed against the Obama administration from those feeling that the Patient Protection Affordable Care Act was forcing coverage on contraceptives that they didn't agree with. Now, here's something to be considered. Cap the tax exclusion for employer-paid premiums. Now, what that means, and this is important, this is the major part of the Republican platform. It was on the Republican platform when John McCain ran. I think it was there when Romney ran. It was on there with the president-elect now. But the Republicans made it part of their agenda too. Now, what does the capping the tax exclusion means? It means similar to group life insurance, where an employer provides a group life policy up to $50,000, that's no tax consequence to the employee. If a group life policy is over $50,000, then the amount of the premium for that additional coverage would be a taxable item to the employee. So capping the tax exclusion really means that after a certain threshold, the money spent by the employer toward the premium for employees will be taxable income to the employee. And of course, the infrastructure to do that is already in place. And you may recall the W-2 requirement under the Patient Protection Affordable Care Act if there's more than 250 W-2s. Now, kind of getting back in the loop and flag that though. Please remember that, because that'll be the one issue that comes out that could have a detrimental effect on participation rates in group programs. Let's see, tax credit for individual market purchase. Again, the trade-off is, okay, if employees are going to end up having a tax consequence from premium, then maybe they ought to get a tax credit for purchasing in the individual market, or possibly even for part of the premium that would be taxable under an employer plan. Association health plans, again, no real rocket science there, but that's something that they've always wanted. Now, I mentioned a couple of sub-bullets under the HRAs and the HSAs. The Republicans traditionally have wanted to strengthen these. Democrats, when in power, and you saw through the Affordable Care Act, have tried to weaken several different ways. Now, what else in the House Republican plan? The EEOC has issued some interpretation of employer wellness plans that suggest that many of them violate the ADA, which is for the disabled, and GINA, which is genetic discrimination. And there's a number of court cases, although the EEOC has been winning them, and so the Republicans want to statutorily overrule the EEOC's outreach on the wellness plan, suggesting that a wellness plan, although flawed according to EEOC standards, is still a wellness plan that's going to be beneficial to participants. Insurance purchasing across state lines, as mentioned before. And here's something that's kind of interesting. What happens if you remove McCarran-Ferguson? McCarran-Ferguson is the state regulation of insurance statute back in the 1940s. So that's also something to watch. Block grant option for Medicaid. And this is important to those dealing with the self-funded market. It's suggesting that the Obama administration has tried to attack the self-funding market, criticizing it as an alternative to Obamacare and a way to get out of some of the mandates. So legislation from the House majority would preserve the definition of stop-loss insurance and maintain distinct difference of self-funding from group health insurance. And then, of course, you've got medical malpractice caps. Interestingly enough, the Affordable Care Act had a section dealing with innovation grants for tort reform for medical malpractice, as long as you didn't do anything to hinder payments to attorneys or to their clients. Now, this is a slide that gives detail, and I'm not going to go over this, but this is what was in the McCain platform. This has a little more detail than we've seen since then, but this does give you the rationale. And if you are the folks with the green eye shades, you're going to take a look at that Congressional Budget Office study listed at the bottom that said that that exclusion amounts to $248 billion in lost revenue to the federal government. And so between 2013 2023, $3.36 trillion. Wow, what could we do with that money? Maybe we should spend it on the massive transportation infrastructure plan. I'm not predicting. I'm just saying that that's a possibility. So that Congressional Budget Office, that is going to be the challenge for health underwriters and those who disagree with this approach on what it will do to the group health market. Now, obviously, a lot of taxation stuff. The 40% Cadillac tax, that's high on everybody's list, and including the labor unions that realize that their plans are all going to be subject to the Cadillac tax. The HIT, the health insurance tax, as you may know, those were put off, suspended for a time, and the medical device gross sales tax, excise tax, as well. But these are the low-hanging fruit where Republicans and Democrats have voted to abolish these taxes, although keep in mind that with the abolishing the taxes, the Democrats have said, we want to abolish these taxes, they're unfair, et cetera, but you got to come up with new funding stream, i.e. new taxes. The Republicans said, let's just get rid of the thing. I mentioned a couple of the bills in this last session that achieved a little bit of traction. But now we get to the question marks. When it comes to taxation, will there be a political will for Congress to rescind the Medicare tax increase for those with high incomes? So does Congress want to be put in a position of taking away money from Medicare and thus hurting senior citizens? Okay, how about the first tax that went into effect, this was in June of 2010, was the tax on tanning salons. And tanning salons is an industry, and they're still around. But the reason for the tax was either they didn't have a good enough lobbyist in Washington, or there was a bit of data that suggests that repeated exposure to the tanning salons resulted in possible health harm. So does Congress want to put itself in a position to be attacked by those suggesting that we're hurting people by getting rid of this tax? And then, of course, there's a $500,000 cap on deductibility of insurance company executive salary, and that was regarded as a payback by Obama to the insurance industry. But is Congress going to want to repeal that because it looks like Congress is in the pocket of the insurance industry, that this is nothing more than an earmark, if you will, or a pseudo-subsidy to insurance? And then, of course, the brand name drug tax. What did that go for? It went, part of it anyway, went to shrink the Medicare donut hole. So if you repeal the drug name tax, first of all, are you looking like you're in the pockets of pharma and big drugs? And also, are you working against, or perceived working against seniors by, well, re-expanding the donut hole? Now, there's also a question mark, and this is a section taken from the Affordable Care Act, Section 6402. It's areas dealing with integrity, i.e. anti-fraud with Medicare, Medicaid. If you repeal Obamacare in toto, that means you're repealing this too. You know, it's always about the details, isn't it? And it's always about the fine print. So, should overpayments be reported and returned within 60 days from the date the overpayment was identified? Should the Secretary of HHS have the authority to suspend payments to a provider if there is an active fraud investigation? And of course, look at the penalty section. The civil monetary penalties, kind of significant. And of course, there's a question mark on a separate section, although it's in the same title of the law, that requires a face-to-face visit with a doctor before a patient may enter a nursing home. So in other words, even though the temptation by Republicans to just get rid of the whole thing, if you look a little bit deeper, there's some fine print that needs to be assessed. In fact, look at that. You've got 10 titles to the Affordable Care Act. Now, some of them deal with insurance, obviously. Quality, affordable care for all Americans, role of public programs, etc. But what about the healthcare workforce? What about program integrity? Again, that's the fraud thing. What about medical therapies? What about community living assistance supports? And of course, Title 10 is reauthorization of the Indian Health Care Improvement Act. So there's an awful lot going on here. And so, again, can you repeal some of the disparate parts of the Affordable Care Act without consequence? For example, you have a lot of expanded public health money there, including a tremendous amount of money going to community health centers. So if you get rid of Obamacare, does that go away? The mandatory restaurant nutrition notices that you're beginning to see in chain restaurants. Targeted health programs, as mentioned, Title 10, workforce development, mentioned. Medical loss ratio, now I know in the insurance industry, agents will not be sorry to see that go because that will alleviate some of the pressure on the carriers that resulted in the first wave of commission cutbacks. What happens to minimum essential benefits? And do you reverse the HSA prohibition on over-the-counter medications? At least that was kind of an easy one, don't you think? And then various wellness incentives, premium tax credits for various wellness programs, and lots of Medicare provisions. For example, buried in the body of the Affordable Care Act is a provision specifying that you must rent wheelchairs under Medicare versus buying a wheelchair. Now, it's a little micromanagement, do you think? But still, though, that's an example of some of the detail work in the Affordable Care Act. Okay, well, let's go to the executive orders. President-elect Trump said he's going to void Obama's executive orders. But I decided to research the executive orders. Oh, God help me, all 210 of them issued since the Affordable Care Act was signed into law. And those three that you see there are the only ones I could find. The first one was basically it was a sop to conservative pro-life Democrats who were reluctant to vote for the Affordable Care Act unless Obama said once again, we're not going to fund abortion. And then the other two, setting up that one council, the prescription drug shortages, that actually tells the drug manufacturers got to notify the federal government if there is a anticipated shortage or if they're going to discontinue production of a certain drug that might lead to a shortage. Not exactly what I'll call heavy lifting within the Affordable Care Act. But, you know, when you come right down to it, it's rather than just kind of taking it away, it's almost like taking away a marble cake. And it's darn if you do, darn if you don't. If you don't get rid of the whole thing and you're Trump, you're attacked because you campaign on repeal of the whole thing. However, if you don't look at it as a marble cake, you're throwing out a lot of stuff that may or may not be important to certain people. And I just picked these examples at random. There was an expanded tax credit for adoptions that the Affordable Care Act kept for 2 years before it went back to its traditional level. Does this mean that the expanded tax credit comes back? There is a Department of Labor Fair Labor Standards Act rule for nursing mothers that they've got to be given a reasonable break time, that they must be given a private space free from intrusion, which must not be the washroom. Okay, now what does it have to do with the Affordable Care Act again? Well, the thing is, like Prego, it's in there, and that would be repealed as well. There was a tax incentive for biodiesel fuel, which you're seeing a little bit more of in the news. That was repealed in Obamacare. Special rule for surviving spouse regarding continued eligibility for low-income assistance. And this is one of the interesting ironies, the Affordable Care Act continued funding for abstinence education by HHS that former President Bush put in there. You get rid of Obamacare in toto, and that means, if there's any social movement conservatives, that means that that would be an unanticipated consequence. So the bottom line is there's lots of consequence. Okay, so if we can't do the, if we look at it as a marble cake, let's see, how are we going to dismantle the parts of which we don't want? Now, some are easy to get rid of. That Section 105H IRS regulation that they've never issued, okay, that's gone. Well, they couldn't figure out what to do with it anyway. And how many times was it, did we see a notice out there, what, 3 or 4 times where they said, we're still working on it, we're still working on it. And other parts of Obamacare will be the same. But still, though, there's over 1,000 regulations. And it's not just the regulations, it's not just the rules, it's the thousands of policy pronouncements, policy positions taken because of interpretations. Here's an example. The IRS realized that the household income provision within the employer mandate was unworkable because the employer should not have access to an employee's household income. So they said, okay, we can't do it the way the law says. We're going to come up with another way to do it, and that's where you end up with the safe harbors that the IRS put in. Now, that's not a law. That is a policy. That is a notice. And the frequently asked questions, which you've seen often, they create policy positions. Those are policy. When the government says, this is the way we're going to interpret the law, that's how they're going to interpret the law. And so there's some real questions as to which rules will go, which rules will stay, and which policy pronouncements, etc. For example, in November, this month, CMS issued a decision to say that short-term coverage may only extend to 3 months. For example, my middle girl, Adrian, when she moved to Los Angeles, she did not have coverage. She was above the age to be called a dependent of mine, and so we got her a short-term 6-month plan to allow her to get established in Los Angeles with her fiance, get a job, et cetera, et cetera, et cetera, and that was very helpful. So CMS arbitrary decision to limit the short-term coverage. Okay, what about the EEOC rulings on employer-provided wellness plans? Now, it's in the Republican agenda for the Congress. Is it in the Trump agenda? And the answer is, we'll see, won't we? And then I already mentioned about the little quirk about the undocumented aliens possibly being required to be reported by hospitals. And then, of course, another one was that the 65 or older received a stay of execution in terms of keeping a less of a threshold for the medical deduction, the Schedule A. So what happens to that if the Affordable Care Act is repealed? Does it all revert back to 7.5% of the adjusted gross income, or will those who are looking at revenue to the federal government say, you know what, we made some money on that deal, we the federal government, and so will there be pushback from budget hawks that say, let's don't touch that, let's leave it alone? Now, there's an individual named Dave Boyer, Washington Times, and I really liked his article. First, it's like a 3 or 4 page article, but I've been corresponding with him. He's interesting enough that I decided to go back and maybe see if I could dip from the well a little bit further. Now, his comment was that there are 1,200 regulations now in the pipeline that could be stopped or withdrawn. Now, let's take a look at that. I went a little bit deeper, and there are a number of strategies that could be used to torpedo that regulations. Some which were never released, such as that 105H one from the IRS, okay, that never saw the light of day, therefore it never shall. So that's easy. If they're in the pipeline and they have been submitted for public comment and returned to the agency to comment on the comments, which legally they have to do, pretty easy to pull those back from because they haven't been issued or submitted in final form. But what about those that are kind of close to the finish line? How do you get rid of them? Well, a couple different ways. One is that Congress could pass a law prohibiting the use of what is called midnight rule. The midnight rule basically allows the administration to push regulations through in the waning days of the administration. An example was former President Clinton pushed an ergonomics rule through after November. And then it took Bush a long time to get rid of it because it was a real rule. And the federal government, again, this is statute, allows for rules to bypass some of the mandated comment or review periods if there is a clear and pressing need to do so. However, one of the other things that can be done, though, is to delay the effective date. Now, at the bottom you see the Congressional Review Act, and I think that's the tool the Republicans will want to really look at. But the major regulation is defined as a regulation with $100 million worth of impact on whoever is regulated. So if it comes under that threshold, the Congressional Review Act may not be able to get in there and excise those regulations easily. Of course, another option is a stay of the effective date. Because after the regulation is published, oftentimes there's a 60 or 90-day window where it hasn't taken effect yet. And one thing that can be done to kick that particular can down the road is for the federal government to extend the effective date until such time as Congress and the President can actually repeal the regulations that it wants to. By the way, the timetable, there is an FDA rule that actually came about from the Affordable Care Act regarding restaurant calorie labeling that would take effect in May of 2017. So if you don't like that, and it's a final rule, and it's already been published in the Federal Register, then you say, okay, let's don't say May 2017, let's say May 2018. And then Congress can get busy and repeal a rule that it doesn't like. And then there's also recension. Recension is where a policy pronouncement was issued either by memorandum or notice, and it has the effect of law, but it is easier to get rid of than a law. Here's an example. The Education Department, when they put forth President Obama's vision when it came to transgender restrooms in the schools, that was not a law. That was an interpretation by the federal government, and that was actually a letter that went out. So what you do if you're the new administration is you rescind that letter. You rescind that policy guidance, and then it goes back to the way it was, which means that those schools that did comply with transgender bathrooms, well, that is what it is, and those that didn't, well, then that is what it is as well. By the way, the federal government has added a great number of regulations in the waning days of the Obama administration. I just took one date because I subscribe to one of the things I get is it tells me what regulations are promulgated every day by the federal government. And yes, Deb says I should get out more, and that's probably true. But on one date, Friday, November 18th, 83,106 pages in new federal regulations. Think about it. And it's not just healthcare, it's also energy and a whole variety of different agencies that have got all kinds of things going on. Now, one of the regulations that I would ask that you all pay attention to, and this will affect your clients. What is an employee versus what is an independent contractor? Now, this is not a new issue. Workers' comp property casualty has been arguing about that for years, suggesting that employers will pretend that the real employees are independent contractors, just get out from paying workers' comp premium. And of course, in California, you may recall reading about the California Labor Relations Board and Uber and Lyft as to whether or not their people were considered employees or independent contractors. By the way, the drivers kind of like being considered employees because they could get workers' comp coverage and mandated health benefits. But I think there's still a little bit of litigation playing with it. But here's what happened, and this was issued in August of 2015. The Department of Labor, they took traditional direction and control, which is how you differentiate employee from independent contractor, and you say, now we're going to say economic dependency. Now, the Department of Labor wasn't thinking about workers' comp or Swift or Uber. They were thinking about the Affordable Care Act, suggesting that some smaller employers were using independent contractors to get below 50 full-time equivalents and thus not have to deal with the employer mandate. And I have to tell you, there's an awful lot of enforcement on that right now. So is this going to be on the Trump chopping block? Some employers assume it will, but until it's chopped, it's still there, and there are still huge penalties. Now, another regulation. First of all, the courts put a temporary injunction against the overtime rules. These were to have taken effect December 1st, 2016. No shortage of lawsuits against that. You had a good number of states that protested. I think almost half the states joined in a lawsuit. You had the U.S. Chamber of Commerce. Lots of other groups also filed legal action. And Texas federal court said that the rule will not take effect December 1. Now, first of all, the Obama administration has the right to appeal that. Given the waning days of the Obama administration, good luck to them for that. But also, the rule is still a viable rule, and it will still be effective depending on how the court rules. So that'll be one of the main things that employers need to look at in the new Trump administration as to whether or not that'll be taken. Now, this slide here, this is just for your background. Since December 1st will not take place, it's just kind of for you to look at on your own time as to what that rule will be. Keep in mind, though, that you can't say that it won't take effect until it is actually voided, because a district court action is not enough to actually void the thing. It's a stay of execution until the Trump folks get to Washington and do what they do. Okay. Now, some of the takeaways. First of all, prognostication is an art, not a science. That's my disclaimer, that if I'm proved wrong in anything like that, well, you know how best guesses can be, right? However, I think a reasonable prediction is that plans for 2017 are not going to be affected. Why is that? Because everything's been approved already. And what's going to happen to the people enrolled now in the exchanges? The chances are, and this is where I should knock on wood when I say this, the chances are they'll be allowed to continue the year through Obamacare, because one Republican scenario is to repeal the law, but to have the repeal take place a year from the date of the signing of that legislation, rather than an immediate and abrupt halt to everything. If they choose to go that route, then that will allow companies in the industry to adapt to whatever changes the Republicans are going to come up with. Now, the other thing to keep in mind is insurance companies have spent millions and millions and millions to comply with the Affordable Care Act, which means they had to basically reinvent their system. Computer infrastructure, God only knows what the real costs of that are. And now the question is, and this is a takeaway, how will you personally learn about changes? This is going to be a kind of a high-stakes, high-velocity atmosphere in the next few months as the Trump administration begins to take power. There'll be a lot of moving parts. So how are you going to learn about this? Now, lots of things. First of all, if you're a member of PAHU, that is a prime resource. Now, what does PAHU get you? Now, this is where I really want you to join PAHU if you're not a member. A daily article summary, and then a weekly report from Washington, which tells you kind of what's going on at the federal level. And that's very valuable, because a lot of stuff that goes on in Congress doesn't really make the media. It's quiet stuff, and that's the stuff that you, as a practitioner and an insurance producer, that's what you really need to know about. That's so that you can keep your clients informed. Information is power. If you have the information, you've got yourself as a huge resource to your clients. By the way, the other NAHU resource is the Compliance Corner, which I find personally useful, and you'll find all kinds of stuff in there, including archived webinars that are helpful. But there are other publications as well. For example, a couple that I personally like, Employee Benefit News. No, they don't pay me to give them this plug, but it's a nice summary. Also, Luxology.com. This is helpful because it provides a one-page analysis to an ACA-related issue. reading regulations is not for the faint of heart, and sometimes it's neat to go on Lexology and see what another attorney, or not an attorney, says to kind of break it down for me. Now, of course, the Kaiser Family Foundation has a daily flipping service, so keep in mind they're very much for the Affordable Care Act. And I mentioned a couple articles that just give you kind of a flavor of some of the regulations out there. And in terms of getting ready to close, I thought you'd like this quote from Ben Carson. I think the replacement obviously must come first, and it must be something that is very appealing and easy to understand, and then only then would you dismantle what's in place now. So the bottom line is, what I've tried to do over the last hour is to give you kind of a working tour of some of the things that may happen with the Trump administration. Again, I mentioned a couple things for you to especially be mindful of, since they would be coming from the Republican-controlled Congress. Now, I will tell you, I mentioned about the House Republicans. The Senate Republicans haven't been quite as cohesive as far as gelling a complete health reform repeal and replace agenda. So, but of course, they've got their ideas too. Bottom line is, those are some resources. Please count on the Pennsylvania Association of Health Underwriters as a resource. Count on PAHU as a resource. And of course, if you have questions, send them to Deb, and I'll be very happy to research anything that you raise. And of course, there's my contact information there. So bottom line is, thank you to CPHU, to PAHU, and to URL for sponsoring this webinar. I hope you have found it to be valuable. Take care.
Thank you, Vince and Gil. There are a couple questions, and then we'll, again, if you want to ask a question, now's the time to type it in. We want to close at 10. Dave says, can the restriction that family-only companies cannot get group insurance, is that one that can be removed?
It depends on whether or not it's an insurance company provision or it's an actual compliance provision. If it's a compliance provision, it can be removed. Now the question is, where does it come from in terms of the compliance code, and how do you get it excised? Is it a repeal of the legislation itself? Is it a rule that has gone into place? And also keep in mind that carriers, if they've implemented policies that relate to the Affordable Care Act, there may be a delay. Even if this goes away from the legal standpoint, the carriers may continue it because it is their usual business practice until they can assess it and decide whether or not to keep it.
Dave's asking another question. The tax penalty for not having minimum essential coverage, do you feel that that would be removed for 17?
Again, I hate to say this, but it's almost the same answer. Obviously, that comes from the federal government. It's not something that the carrier would have anything to do with, since it's rather a penalty imposed by the federal government on non-compliance.
Right.
Now, if you remove the statute that says MEC altogether, you void the fines, but do you void the fines that are pending and in the pipeline, or can you have a clean slate going forward? So again, I think they would need to look at precisely what guidance came out of the federal government that specified the fines that would relate to 2017. My guess is that, that there's an obscure IRS notice that probably said, this is what we're going to do 2017. This is the fine schedule. This is the effective date. Is there a good faith provision? Probably not. But so I think, yes, that can be removed, but it's going to take some affirmative action by the administration to identify exactly how to remove it.
There's another question from Brian. He says, if we have a state-run high-risk pool, would they eliminate the pre-X clause? For example, go back to underwritten plans, but have the high-risk plans for those that don't qualify.
Well, actually, that's an intriguing question, because on one hand, you've got the Republicans saying we like risk pools. On the other, you have the Republicans saying we want pre-existing condition. Let's see, if you have pre-existing condition, do you need risk pools? And that's really the question.
Right.
I think that's a very good question, and I think that points to a contradiction within the Republican view of what happens to health care reform after the Affordable Care Act is repealed. Now, personally, I think that the pre-existing condition, I hate to use the word trumps it, but you know what I'm saying. I think, however, the risk pools might be kind of on a targeted basis. For example, and this is where my ignorance of the self-insured market comes through, since I haven't really focused on that. But I don't know if there's medical underwriting in the self-insured market. I believe there is.
Yeah.
And if that is the case, then a risk pool would be a nice safety net for those people.
Dave has a question. Will transitional relief be continued?
The $64 question. I think the carriers would like to know that too. What did Highmark say, that they lost $250 million of promised monies from the federal government that were not remitted? My guess is that Congress is not overly keen on continuing any of the transitional relief. I've seen articles and some of the statements from congressional leaders that say that they look at that as a corporate subsidy, and they don't see the. I'm not saying that I like the transition resources devoted to it, but realistically, if there were transitional resources, it would have alleviated some of the market turmoil in the individual market. But I don't think Congress is very receptive to continuing that type of support to the insurance carriers.
And I for one will be happy if one thing gets done, and that's the elimination of the employer mandates and those 1094s and 1095s and the measurement periods. Should I go on? Yes, I said one thing, but those are what I'm looking forward to. So that's really it. Those are the questions. Again, we want to be respectful of your time. Gil, did you want to say any parting words?
No, not really. I just, again, want to thank Vince for doing, as always, a superb job on the presentation and very valuable information that we can use going forward. And just encourage those members to get involved in this process as we help try and develop these changes going forward. And if you're not a member, please seriously consider. All information is on the PAHU website, and reach out to one of us, and we'll be glad to answer any of those questions regarding from the association side. Again, thank you very much for participating and attending in the webinar.
All right. Thank you, everyone, and enjoy your day.